You're watching Creme 2 News at 4 with Tom Sherry and Whitney Ward.
Well, the Omicron variant continues to surge across the country and here in Washington state. According to Spokane Regional Health District, as of today, Omicron makes up about 83% of COVID cases now in Washington state.
In the meantime, there are new numbers from the State Department of Health that show 2 cases of the Omicron variant have been detected here in Spokane County. Creme 2's Cody Proctor is joining us now live with more about what the health district is recommending as this new variant starts to take hold. Hi, Cody.
Hey there, Whitney and Tom. Due to the surge in the variant, the health district recommends following the new quarantine guidelines from the Centers for Disease Control and Prevention, which updated late last month. So let's break them down. First off, say you test positive. What happens now? Well, citing the CDC, Dr. Francisco Velasquez of the Spokane Regional Health District says stay home and isolate for at least 5 days or until symptoms resolve. Now, the 5 days of isolation is a big change from the previous 10-day minimum. He says part of the reason of that is because the Omicron variant tends to move faster than the Delta variant, with symptoms appearing even earlier. So reducing the time you need to isolate will be consistent with some protective effect with the Omicron variant. If you have symptoms at the end of the 5 days, you do need to stay in isolation until they're gone. Also, as precaution, let anyone else that you've been in close contact know that you have tested positive, and so they can prepare as well.
Okay, Cody, so say you test positive, but you don't have any symptoms after 5 days. What do you do next?
Well, according to Dr. Velasquez, he says that you can actually leave isolation, but you do need to continue wearing a mask that fits you well for an additional 5 days in public around other people. During that time, still watch for symptoms to develop, because if they do develop, you do have to go back to isolation.
Okay, so this is something that we've been hearing about a lot. What about people who know that they have been exposed to someone who has then tested positive, but they themselves haven't tested positive and they don't seem to have symptoms?
Okay, that one's been a really interesting one because that has changed somewhat. Dr. Velasquez says get tested 5 days after exposure, although that can happen sooner with Omicrons because symptoms for the variant actually tend to develop quicker. So some have tested as early as day 3. If you're unvaccinated or eligible for the booster and you haven't gotten it yet, you need to quarantine for 5 days and wear a mask around others for another 5 days. However, if you are vaccinated or boosted, you don't actually need to isolate. Instead, health district officials say to wear a mask for 10 days around others. You won't need to quarantine unless you start getting symptoms. Now, of course, while symptoms for Omicron do tend to often be milder compared to other variants such as Delta, Dr. Velasquez says that doesn't mean it's milder for everyone, so the risk is still there. He does remind you, if you have any difficulty breathing or chest pain, seek medical help immediately. In the newsroom, Cody Proctor, Creme 2 News.
Well, we know this is a lot to keep track of, so for the latest coronavirus headlines, just text the word COVID to 509-448-2000. We'll send links with this information straight to your phone.